Hey, we're CB squared. So we're going to be talking today about the inconsistency in costs within healthcare within your own PPO or HMO networks. And then we're also going to talk about pharmacy and the same thing, that there's a inconsistent price model that is nearly impossible to figure out. So, you know, Chris, I think you have the best analogy around gas,
Yeah.
how easy it is to figure out what something costs.
Well, you and I, spend a lot of time on the road in a normal year.
Yeah.
We're getting back into that travel, and it's technology has advanced so much. We can pull up our Gas Buddy app, or we can pull up, that specific chain of gas stations app, and we know exactly real time how much gas costs in that specific location by
Button,
by
right?
quality. If you want the premium, or you want to go E15, you can find out exactly how much it costs. And that really changed how we purchase gas, because before, you were stuck in my neighborhood or I was stuck in my community, and it was all relative to where I was at. But think about that. You've noticed, that all of the gas stations are going to have something fairly similar. They may be 5 cents off here or there to try to get you in the door,
Right.
but nobody is 30 or 40% higher, because nobody's going to go there. That's the problem that we have in that inconsistency, is that, as an employee, I either pay my copay, but I have no idea what that actually cost, or I go in and just hope that what I'm spending is going to be affordable. And then I find out after my procedure or after my event. So, Chris, when did we start to realize that there was such a difference in cost between healthcare? I mean, what have we seen just basically in that technology right now that an employee can see, and how did that help us realize that there is that difference?
One of the good things that came out of the Affordable Care Act was this PCORI fee. And, the PCORI fee, we just simply call a technology fee.
Yeah,
And it
that's a good way to
was,
put it.
yeah, it was basically taxes built into a fully insured premium or a self-funded premium. And all that money was, really supposed to be used to improve the technology of healthcare. And, what we've seen is carriers reinvest into, apps
Right.
that can, show you what it's going to cost if you need that MRI or if you need to go see a specialist. There was supposed to be some transparency there. Through that is when the light bulb went off, is when, you and I started doing searches and we're like, wait a minute, why is an MRI $6,000 at this place and $850 that's two
Right.
miles down the road? What the heck are our carriers doing?
Yeah.
You know,
And
why?
we started looking at that when, we were talking about using the technology to help employees figure out where to go. And actually, whether it be, United Healthcare, Blue Cross, it doesn't matter. Wellmark, they all had that. Now we can search for provider and procedure, and the estimated cost was that. I mean, tenfold in some cases, and kind of just stopped and put us back to think about for a second.
You know, Reminds me of a great conversation we had 2 weeks ago with a orthopedic group, and
Yes.
we were talking about the different costs of care throughout the country. And you remember what he said? He
No,
goes,
go ahead. Yeah, share that again, because it was awesome.
because you're buying into this illusion. There isn't a major difference in us providing care. It's the health systems set those prices.
Yeah.
So if a health system, in a bad example, Peoria, Illinois, has a 30% higher cost than in, you know, Davenport, then they are setting the trend of why healthcare will cost more in that area. And
Yeah.
again, I mean, I've done this a long time, but to
Right.
really get in the room with providers and start having business conversations, you
Yeah.
just realize how complicated this industry is.
Yeah. And you talk about the difference in that network cost, and so much different between one provider or the other. Just like you said, they could take less potentially, but if it's being said and this is the market price that's there, why would I take less? That's not a good business decision.
No.
But it also, there's still not that easy understanding from the employee. And that's the problem with the network, is that everyone's included. All of the health insurance companies and the network creators wanted no disruption. We wanted everybody to be in the network. And with that, there is no discussion of how much is the price. It's just you can access care.
Yeah. Well,
And
and
that's a huge disservice to a family.
right. I mean, it's all, well, we have the highest discounts, but your discounts are on a bogus number.
Yeah. Yeah.
It's like saying, I can buy a brand new Ford F-150 for, bad example, $50,000. But if a dealer says, oh, well, it's $70,000, but I'll sell it to you for 40,000. Oh my gosh, my discount's huge at this dealership. It's a bogus number.
Yeah. End of the day, it's the final number that's important, both for the health plan employer dollar and that family's cost.
Yeah, it's sad that our carrier propositions have all come down to, we have the biggest network,
right?
Or we have the biggest discounts.
Right.
But none of it is built on what it should have been built on, which is, if you want to be a part of my network, here's my pricing, and there's no difference.
Yeah.
Think
and
how
this is
it would be,
Yeah, totally change it. But this has been, decades of building. It's not like this. I don't know that this was the intention. I think it was truly trying to figure out how we help families get access to their doctors so they can go where they need to go. But in the midst of all of that, price was never the conversation.
Yeah.
So the other thing too, you talked about was pharmacy. And, again, so many consumers, it's $5, $10, $20, $50, $75 copays. You're saying that there is a different actual price for that prescription behind the scenes that the employee doesn't experience, depending on where they purchase that prescription.
One of my best stories is our HR contact at one of our clients went to go get a Z-Pack filled.
Typical.
And went to a pharmacy that we have a very good relationship with. And she's sharp. I mean, she watches every dollar. She pays her, $10 copay, gets the receipt, and it says on there that it was $120.
Okay.
This person also has a very good relationship with this pharmacy because we actually built it into their plan that it was their preferred pharmacy.
Yeah,
and
very true.
And she calls the pharmacist and says, what was the ingredient cost of that? And she said, it's 8 cents a pill. And I gave you, I think it's 7 or 10 pills.
Yeah, probably 10. Yeah. So 80 cents.
80 cents. And she said, and what was your dispensing fee? And she goes, actually, for this drug, based on your prescription benefit manager, we don't get paid at all.
Wow.
So I just paid $120 for something that cost 80 cents, and you didn't even get paid to fill it.
Wow.
So this is the whole prescription benefit manager game. It's all spread. We are driving these poor independent pharmacies out of business
because they're not getting paid.
Not getting paid. And, the PBMs are getting paid all the money right now. And, so to me, I go to two things. Number one, have the conversation with your doctor. If you're on a high cost medication, is there a lower cost option available? And then the second thing is do that same price shop. I mean, we have an app that shows us how much that drug is, and it's shocking. It's Walgreens will be, bad example, $80, Hy-Vee will be, $40, and Walmart will be $4. I mean, it's that big of a difference of what's being charged back to your plan. But I was guilty of this, Chris. For years prior to being on my HSA, all I looked at was my copay.
Right. You didn't think about it. Copay and convenience.
Until one day I went through Walgreens, and now I'm on an HSA, and they said that'll be $650. I'm like, bull crap. I ain't paying that.
Not paying for that anymore.
Called my doctor, and of course I was on a compound drug.
Right.
It was basically two drugs mushed together into one pill. That same basically therapeutic, I take
result, right,
for $4 each.
Yes. And see, that's, again, technology has helped pull that back. I mean, there's so many apps that are out there that you can see what a cash price for a prescription will be. And you can see that two of the exact same pharmacy chain in the same community will have a different price. And you'll see that spread is there. And, again, if I don't have anything but a copay, I'm not going to think about that.